Welcome to the Mental Health Boot Camp podcast.
Hooray!
This is a podcast where 4 therapists, 3 of us Canadian, 1 of us American, serve you cutting-edge mental health knowledge. I'm Dr. Ryan Howes, a clinical psychologist from Pasadena, California.
And I'm Dr. Brooke Lewis, a registered clinical counselor from the Vancouver area in Canada.
And I'm Joanna Boyd, a registered clinical counselor, also from the Greater Vancouver area in Canada.
I'm Chris Boyd, psychotherapist from Vancouver area.
And
I am friends with Ryan and Brooke.
Party hard.
yes, friends with Ryan and Brooke and a sibling to Joe. You can't escape it. It's the way it is. Hey, everybody. Happy Earth Day 2021.
Indeed. Did you do any Earth Day things?
I went outside and enjoyed the earth for a while.
How did you do that?
I just went for a jog, enjoyed the fresh air. It actually sprinkled a little here today. It was kind of nice. It was a beautiful day, not too hot. And I'm grateful to the earth for providing that to me.
Wonderful.
Yes. How about you guys?
I was inside all day, just working.
Yeah,
I didn't really do anything different, unfortunately. I didn't. Yeah. I had to have the lights on to work. I had to use my computer. And tonight, other than, see, these lights are on behind me even. I can turn those off. Anyways, but I was outside for a little bit, appreciating nature for sure. But
yeah. You have a shrub behind you. You have a little plant back there.
Uh-huh.
Oh, you have 3. Wow.
Uh-huh.
Your head was hiding the other 2.
Whoa!
Buzzers.
Wow.
I can just keep going. They're everywhere.
Wow.
I'm showing plants to those listeners and people who can not see us. But anyways, how about Chris, Brooke? How about you guys?
Sibo?
Yeah, it was a beautiful day. So I got off a little earlier today at 5:15 and hung out outside for a while. So really appreciate it. I've been doing that mindfulness exercise lately. You know, the 5 things you see, the 4
things you hear.
Yeah. Is it 3 things you can touch?
3 things.
I think you got me all mixed up now. I think it was 5 things you can see, 4 things you can touch, 3 things you hear, 2 things
you got it.
1 thing that you can taste. Tasting part was a little more tricky outside, but I figured something out.
Did you eat a flower?
I did. No, I just had luckily I had a bubbly, sparkling water close by.
Very nice. Yes. I've heard that called a grounding technique.
Mm-hmm.
You call that, or just a general one of the many mindfulness exercises?
It seems to be a lot of overlap there, right?
Yeah.
But definitely a grounding exercise.
The idea that you're grounding in your senses. You're just being very aware of what's going on in your senses, which means you can't really be jumping ahead to the scary things of the future or regretting the things of your past. You've got to be right here and now, right?
For sure. Just trying to figure out the order of what to do next.
There we go. Right. That's cool. Well, good.
You guys did good. Yeah, no, I didn't get. I was just telling these guys before we started recording. I had quite a long day, so I don't think I got much Mother Earth time. I did go for a stroll this morning. I've been getting up, putting my sweatpants and stuff on right away, and taking my dogs out immediately for a walk instead of waiting until later in the day. So that was nice. Got to hear lots of birds and stuff. But being Earth Day, I'm going to make a plug for a local company that we have up here. We have a company, True Earth, and their mission, they're trying to reduce plastics, as many companies are. So they have patented like laundry detergent that comes in strips. So the strips come in a cardboard envelope. So it's like reduced capacity, so it doesn't take up a lot of room. You can recycle the cardboard packaging, and then these strips, you just throw one in your wash, and then you're good to go. And then today I noticed they released an all-purpose cleaner strip. I don't know.
Oh, how does that work?
So it's similar. It's just like this little strip. And then if you want to use it for like cleaning counters or bathrooms or whatever, you just like put it in, if you already have a spray bottle, put it in the spray bottle with warm water and it dissolves. And then you can use that as an all-purpose cleaner. If you want to use it as toilet bowl cleaner, it's a half a strip. You rip it apart, throw it in your toilet bowl, it'll dissolve, and then you can clean. If you're washing the floors, you put a full strip in your bucket. It might be 2 strips for that. And then, yeah, have at her.
Wow.
It breaks it down. So
Wow.
there's like no waste, no plastics are used. Super cool company. And they're local, out of our community, about a 7-minute drive away from where I live, probably from where each of us lives, actually. So yeah, pretty cool company. Cool dudes. So they're trying to take over all the cleaning, anything that you would need for your laundry, kitchen, or bathroom. Eventually they want to have products for that. So
Can I brush my teeth with it, Brooke?
not yet.
Or take a strip and put it under my armpits for deodorant?
Not yet.
But maybe soon, huh?
Maybe. So
Maybe
I'll do a
soon.
plug for this company because they're pretty cool people.
Cool. All right. Mental Health Boot Camp podcast brought to you by True Earth. Well, not really. They're not a sponsor.
No.
Yet, so we'll
No.
see. Well, that sounds really great, though. That sounds like a very forward-thinking sort of a group.
Wouldn't it be great if we actually had sponsors and every 15 minutes we have to stop and just talk about our sponsors? Oh,
Do
We have, like-
podcasts do that?
our parents. Oh yeah, there's always commercial breaks and it goes through all the different sponsors or yeah, everything.
pretty-
But just a shout out to our mom and dad for the unconditional support. All right, well, let's get back to things.
Thank you to Dennis Boyd and Associates. Yeah.
If you have to mail things but hate going to the post office, stamps.com. There's
Yeah.
always those sorts of little ads. And
Oh yeah.
I would love to do those, though. I think we'd do a great job at it.
I
So
think so too.
if any of you listeners out there know of anyone who may want to sponsor a podcast, we're open. We're
Yeah.
receiving pitches now.
Yeah.
Just a little update for you guys. I did reach out to United States Surgeon General Vivek Murthy and tried to see if he would join us on the podcast next week for our book club, where we're discussing the book together, written by him. And I have not yet heard back. I'm sure it's on his list. I'm sure he's going to get back to us. He probably doesn't have much else to do next Thursday. But I did reach out. Haven't heard back yet.
Thanks, Ryan.
Hey, no
Thanks for the
problem.
update.
A for effort.
There's still time. There's still time.
There's still time. I'm sure he's like, gosh, I've got nothing to do. If he's in DC, he's like, I've got nothing to do next Thursday at midnight. So
yeah,
maybe I should be on this podcast. We'll see. But I gotta say, you guys, that book, it makes an impact. I'm not going to say much more than that, except to say that I have finished the book.
Oh, good.
I have
I have
finished
not.
it.
Neither have I.
I'm halfway.
Okay.
Halfway.
Well, hope you guys have some reading time this weekend, because
Yeah.
we got a deadline.
We do.
I think we will. It's we're only allowed to hang out with people outside, and this weekend's supposed to be very rainy, which means less hangout time, more reading time.
Oh man.
There we go. Well, good.
Yeah.
I'm going to have a lot of things to talk about. I hope you will
Yeah.
too.
I think so.
Yes. So that's it, everyone. The podcast next week will be our first ever book club together by Dr. Vivek Murthy. And I think it'll be fun. So
I think so too.
I think so too.
I think so. 3.
I think so. 4.
All right.
So predictable, Chris.
My goodness.
Let's hop to our topic tonight, shall we?
Sure.
I don't know what
Should I
that
set
is.
it?
It's
Oh, not yet.
It's Brooke's topic tonight. She's the only one who knows what it is. This is the ambush. She ambushes me, or us. She ambushes us with the topic, and we have to try to respond. So hit it, Brooke.
Oh
coming across the
man, I'm
board
nervous.
now.
It's often a doozy. That's a good sign.
Wow. Okay, I'm not sure. All right, I'm just gonna read what was sent to me from who I think is Brooke. I'm not sure. Okay. Do you think aliens could actually be humans from the future who learned how to time travel?
I'll send another one. I was just being funny.
Oh,
Oh, that was good.
wow.
She really got herself.
It's like
Look at
got
her.
she's
lost it.
Crying.
She's in tears over her own joke.
It's so good. I needed that today. Okay.
That's a great response, Ryan.
That is perfect. Do you think aliens could actually be humans from the future who learn how to time travel? That's good. Makes me wonder about the legality of cannabis up there. I'm not sure what the status is. Brooke is in tears. It's great.
That's so good. Okay, I sent a real topic.
I mean, we could talk about some things regarding this one, but okay, maybe some other time. All right, here's the real topic. Not quite as funny, but still a lot to talk about here. All right, how do you? Oh boy,
She's gone.
you got a case of the giggles now.
Twirling around. Yeah.
Oh boy.
I'll be back. Go for it. Go for it.
Okay. How do you support a family member who is going through mental health challenges? Right? How do you support a family member who's going through mental health challenges? That is a much more serious topic, but a really important one and valuable. So, support a family member going through mental health challenges. I've certainly encountered this in therapy. As far as like having a client who's going through mental health challenges and like the family's not sure, well, what can we do to help? How do we be part of the cure and not part of the problem, right? Or what can we do to support and uplift our family member? I've even had people who came to therapy with the sole reason of, hey, I have a child, sister, parent, someone who is they're going through some mental health problems and I don't know what to do. So kind of like I'm there to want to learn from me, and they also kind of need their own support to help their own family member. So this is something that I've encountered a bunch. Have you guys seen this before?
Yeah, I think it's safe to say that everyone experiences a mental health challenge at some point. So the probability or the chances are very, very, very high that everyone's experienced either themselves experiencing a mental health challenge or a family member or someone in their close social network. So I think this topic is going to resonate with a lot of people.
I think so too. I just noticed recently, well, this topic comes up a lot in session from parents or family members in general reaching out, trying to help. But definitely I've noticed more here recently with parent-teen dynamics, just because I feel that teenagers and people in their early 20s, it's like extremely difficult for that population right now because it's so centered around being social and they're not able to do those things, right? So I feel that the emotional mental health challenges have been increasing, and then that's putting obviously more stress on, not stress, but concern on family and friends, and they want to know what to do to help. So
yeah, it's an interesting topic because I think in a lot of ways there's some common themes in terms of how to support a family member, but also there's some maybe some unique ways based on what the presenting issues are.
yeah.
So how you support someone with who's experiencing depression versus anxiety versus addiction, for instance. I think the approach may vary according to the presenting issues.
That is certainly true. I think there are also, we're going to want to mention maybe what might not be helpful for some of these folks, right? And what might not be helpful for the family member. You know, we get into some areas like codependence and that sort of thing, where like an enmeshment, like when is enough, right? Okay, so I think it might be helpful to start with maybe a hypothetical or something, you know, because we could just talk in general about a lot of things, but maybe we could just use a kind of a generic case study here to start with. So let's say that you are let's say it's a sibling. We'll start with that. We'll go with equal. Your brother or sister seems to be going through some, let's say, depression. They're withdrawing from social situations beyond what COVID restrictions might be. They are kind of non-responsive, tend to be, they don't return your texts. You get concerned about their moods, and they seem to be irritable or sad or just kind of low energy. So there we have a family member going through a mental health issue. How might we proceed, do you think?
Yeah, I think I think you kind of captured it there, is if the family member is kind of deviating from the norm. So if they're acting differently from their baseline. So you mentioned maybe staying in the room more, or losing motivation to do things, not seeing friends as much, very quiet. Like, a lot of parents don't exactly know what's going on with their kids, or siblings as well. You may not fully understand it. So I guess in that circumstance, it'd probably be likely sadness or depression, right?
Sure. That's what it sounds like.
I guess it could be anxiety as well, a bit too, perhaps.
Well, regardless, you're noticing something's going on. I don't think it's even necessary for the family member to diagnose even. They're just noticing there's something's changed, right?
I guess right off the bat just seems so simple, but reaching out to that individual, if you notice they're not themselves or all the different things that were just listed, hey, just want to check in, see how you're doing. I noticed that you're kind of withdrawing, or it seems like you're having a tough time. Do you want to talk about it, or how can I support you? Sometimes people might need a non-judgmental space to just be able to talk. And so it's important for whoever you're supporting to really go in just with the intention to hear and to listen, because sometimes that's what someone might need in that moment. Yeah, so checking in would be, I guess, what I think of.
Joanna, can you maybe go into what the difference between non-judgmental listening versus judgmental listening? Because I think sometimes our clients or people that I know think they're non-judgmentally listening.
Mm-hmm.
They're listening well. And then when you kind of witness it or hear it, you're like, oh, okay, I see where we could fine tune a little bit.
Yeah, I guess I think it kind of gets into a little bit of what does listening even mean, I guess, right? Like, to listen to someone, you don't necessarily need to agree or fully understand, but it's just to be able to listen, to kind of check in, like, oh, you seem really sad. Is this what I'm hearing? Or I hear you're upset about this. You're not putting your own opinion on it. You're not saying things like, why would you feel that way? You have nothing to feel down about. Like, oh, come on, not a big deal.
Don't feel
calm
that
down.
way.
Don't feel that way. Look, there's so much to be grateful for, or like, just, like, just, I guess judgment could come across as more dismissive language. Yeah. Like, don't feel like that. Yeah, I don't get it. Why are you have nothing to be depressed about. Or if someone shares something and you're like, you might just have I think of judgment just simply that, I guess, like you said.
Yeah.
You might have a response.
Even trying to jump in and fix it. Like, well, have you tried
Totally.
medication? Have you tried gratitude? Even just jumping in with a solution without really hearing the person first and maybe waiting for them to ask for an opinion, that can feel judgmental. Like you're just saying, well, you're dumb for not trying this thing.
Yeah. Because if that's your initial response, or if you wonder, like, seem like, oh, I don't get it, that's weird. That person's going to shut down. They're not going to open up to you. This is not a space to share your opinion unless it's asked for, or to go into fix it mode, because they might not want ideas. They might just need a kind ear to listen. And another thing people might do, which I guess goes into the don'ts a little bit, would be, oh, I know exactly how you feel, or this, oh, I relate to that, or let me tell you about this time, or I know so-and-so, like going right into their examples. I think people try to relate a little bit, or try to show that person, hey, I know how you feel, but that can come across as, well, you don't know how I feel exactly. You're not in my shoes, and you're not really even listening to what I'm going through right now. You're just switching the direction a little bit.
It's true. Yeah, I had many clients, so you got to be very careful in saying that. You want to stay away from those words. I know or I know how that feels, right? It's more using words like, that must be very tough for you, or just, again, the active listening piece is so important. I think it's okay to come out and try to name whatever you're noticing, right? Oh, it seems like you're feeling really down. Seems like you're feeling very anxious. If you're wrong, they're probably going to correct you. But the main goal is
okay.
That dialogue, right? And I know for a family member, it can be very awkward, and you don't want to see a family member hurting. So it's a great point. Sometimes you want to get in there and try to fix it and offer your wisdom, but be very cautious in doing so. You probably just listen and really try to understand what they're experiencing, the emotion beneath the words. If you can focus on the active listening, I guarantee you it's going to benefit them.
Who wants to role play that right now? I'm the one who's withdrawing. Who's going to be my caring friend or sibling or family member?
I've had enough work hours today. I'm not active listening anymore.
The
I'm passively listening to your conversation.
Way to set a boundary, Brooke. I love it. Chris, are you up for that?
I can do it, sure.
Okay. So I'm ho-humming around the house, and I'm withdrawn, and I look just kind of sour. So
sour.
Yeah. So you tell me. You go ahead and intervene.
Okay. Hey, Ryan, how's it going?
It's a crappy day, man.
Yeah, I've noticed that you've had quite a few crappy days lately. Are you doing okay?
I'm all right. I don't know. I'll get over it. It's not a big deal.
Okay. Do you want a hug? No, just kidding. That's tough. Like, is there anything I can do to help you out, or what's going on?
It's just that I reached out to somebody to try to get a response, and I couldn't get a response. And it just feels like, it's just worthless. I like no one ever listens to me, all I want is for the Surgeon General to come on our show, and he's not even writing back. And I'm bummed out about that.
Yeah, it seems kind of rough. That sucks.
Yeah.
What do you usually do when you feel this way?
I mope around, really. I guess it kind of goes away after a few days. But it feels good to talk about it, I guess.
Yeah. Can I do something to help you out, or?
Yeah. Will you write him too?
Sure. I'll write him too.
Great. We're in this together. Sponsored by Together. But that was very good job, Chris. Thank you very much. It sounds very simple, but there were actually a lot of things that Chris didn't do that were very important, right? During that. So just from the stuff we were talking about. He didn't push too hard. He just gave me an invitation to say, hey, you want to talk about it? I've noticed you got feeling so great.
Yeah, I nudged a bit. I asked a couple of times, right? Because
Yep.
So, and then you eventually opened up a little bit, but I tried not to push
too hard. Too hard.
But it's
Also,
very casual, right? Like usually these conversations happen in a very casual way, not like, hey, we got to sit down. It's might be more in passing.
right. And as mentioned before, you didn't jump in with, oh, you shouldn't feel bad. It's a bright sunny day outside. What's wrong? Or well, did you try writing him again? Or all these different, or even joining in and saying, yeah, I feel that way a lot of times myself, right? I know exactly what you're feeling. I know exactly how that felt. So I pause on that because I know that this is something that for some people, this comes very easily to be a non-judgmental listener. For other folks, it really is hard to kind of restrain yourself from trying to fix the problem, or trying to kind of over empathize with them, or push them too hard. Come on, talk to me, when you could really be doing could be pushing them away through those actions. So yeah.
Well, just off that, Ryan, you could, if someone, you can check in and say, yeah, hey, you seem kind of down, or I notice you're kind of spending a lot of time by yourself. Like, do you want to talk about it? Or is there, how you doing? And if they're like, no, I don't want to talk about it right now, you can kind of do another nudge like Chris did, or you could be like, okay, well, yeah, this is where you can find me, or, if you do want to chat a bit later, or, hey, maybe it's okay. Maybe I'll check in with you tomorrow, but no pressure. But I'll just, because sometimes people who especially are going through feeling really low, they might not reach out. So sometimes it's good to just every now and then just check in, because they might need that.
True. Yeah, like if Ryan didn't give me anything next, then it might be like you back off a bit, right?
Like, don't take it personally.
Next approach might be, why don't we do something together? Hey, I'm gonna go run some errands. You want to come with me? Or I'm gonna watch a show, spend some time together. So it's more just being around the person, probably the next move, perhaps. It's tricky though, because if time goes on and the person's kind of closed off, and you're realizing that things are intensifying or getting worse, then what do you do next? What would the next move be?
Well, that's where we get to some more advanced stuff of some real resistance, right? If someone seems like they're really shut off and don't respond to those kind of gentle invitations to join with me in conversation, tell me what's going on. Then you have to sort of start making some decisions, don't you?
Yeah.
You have to decide, okay, is there more that I can do here myself? Do I need to get some other people involved? Is there someone I need to tell that this is going on, right? And it gets a little more confusing, or a little more complicated.
And just even just reminding them too, right? Like, it's whatever you're feeling, it's okay. And it can be scary to share, but I want you to know I'm going to do my best to listen, or so there's no judgments or shame, no matter where you are. Like, you don't need to be alone with this, and just kind of the laying it out, because I don't know, sometimes people might like to hear that, or at least it's nice to know you're not alone. It's okay to feel. It's okay to not be okay.
Yeah.
I think it's also, while we're talking about reaching out and connecting, I think it's very important to do that, those touches, or to offer, and to join in activities or connection. I think it's also important during that time, as a friend or family member, not to make every conversation from that moment on, once you realize that something's going on, about that thing.
So true.
About the depression or the anxiety, right? To put such a spotlight is just going to make them more uncomfortable or vulnerable.
Yeah.
So it might be nice to mix it up with just a normal, whatever you would normally converse about, right? Totally. Like, how was your day? Or, I saw this funny joke and I thought you might like it, or whatever.
And what that might be about is you, as the concerned family member, containing your own anxiety, right? Because if you find that that's all you're thinking about and that's all you're talking about with that person, it probably means that you're feeling really anxious, and concerned, about their well-being, but the hounding them about the question about how they're feeling and what's going on, how are you doing, is not going to make issues better, or rarely would that make anything better. So you might have to think about, like, okay, this makes me really anxious. What do I need to do about my own anxiety? You know, do I need to talk to another loved one or a therapist or something about how this makes me feel, or practice grounding techniques or breathing exercises or something like that, so that I can just say, okay, I'm taking care of me first, really.
Yeah, and I think that's also really important, because the person who's struggling, I think, can really pick up on that. So if you're not able to hold space or be able to hold that emotion for your loved one, I think they'll just naturally share less with you. I think this is like a subconscious cue that they pick up on, that if you're struggling or if you're over asking, they might be like, I don't think that they can handle it if I share that with them.
Yes.
True.
You know, because it's a lot to unload, and often people who are struggling are worrying that they're going to be a burden to those around them. So if they unload and then that person is now freaking out and or becomes more anxious, that actually will make them recoil more.
Yeah.
Yeah.
Oh, good point.
And I don't know if we want to fast forward to, hey, you know for sure that this person is kind of dealing with some depression, or they've talked to you and you kind of know where they're at, and this has been going on for months or even years. Like, you know, how do you continue to support that person, or how do you continue to take care of yourself as that sibling or that partner? That's a big part of it too, right? Encouraging, because it's not all on you as their loved one to make things better or to fix things, but you also want to, how do you support them to support themselves, or how do you navigate kind of their ups and downs, right? So we don't need to we don't need to talk about that necessarily, but I just feel like once you're past that whole figuring out what's going on, supporting someone with ongoing mental health challenges, it's hard.
It can be very hard. Yeah, there's definitely like a parallel processing that can happen where the client themselves start to feel so powerless over their mental health if it's prolonged and severe, and then family members can sometimes feel that exact same powerlessness over not being able to help their loved one. So now we have two people going through the same feelings, tracking each other a bit there. So it can be challenging.
Certainly can. Okay, so let's say, you know, in this scenario with the depressed, kind of withdrawing loved one, you do your non-judgmental listening and they open up and they start talking about it a little bit, and you know, maybe they feel reconnected, and that may be all you need to do. You know, when we're talking about someone just being stressed out and kind of withdrawing a bit, you may just need to just invite them back into conversation, and that may be the extent of your interventions, really. You know, try to keep that line of communication open, and for some folks, that will be the end of the story as far as intervening with a loved one.
Yeah.
But for others, either you may encounter either more resistance than that, or the issues may be more severe than that. Just, you know, I'm having a bad day, or I'm upset about someone not writing me back to be on the Mental Health Bootcamp podcast. But you know, there may be more to it than that. It may be more complex. Maybe we're talking about some more significant mental health issues as well that won't be cured with a conversation with a loved one, right? So let's travel the resistance route first, right? Someone is just like, nah, I don't want to, you can't make me talk. What do you do then? If someone just is pretty stubbornly, defiantly not wanting to talk to you, and yet you can tell there appears to be something significant going on.
Yeah, I think it differs based on whether it's a child, like if it's a teenager or child and you're a parent, versus a sibling. I think parents have, obviously developmentally speaking, children and teens, it could be a bit of a roller coaster, and they're in a position where they may have a bit more clout or a little more flexibility or ability, I guess, to encourage their child or teen to get the support they need. But I think sitting down and saying, hey, you know, I've been noticing that you've been having a bit of a challenging time, and I know it's not easy to talk about these types of things, but you know, I'm worried about you. And so maybe being specific in terms of some of the things that you've been noticing, as well as you know, maybe suggesting that they reach out or talk to someone, or because these are not behaviors or of someone who is having a great time. So we're hoping that maybe a little more of a upfront or fireside chat can maybe encourage them to get a bit more support.
So yeah, you're talking about kind of trying to bring it out in the open, kind of trying to at least let them know that you see them, right? Hey, I see you, and what I see seems, everything you're communicating to me says that there's some struggle going on, there's some pain going on, and I'm here for you. And you know, if you need anything, please feel free to reach out, or I'll try to reach out again later. And if you keep getting kind of the door slammed in your face there, and again, it's a parent-child, then yeah, I think you're going to have to try to step it up a bit, right? Like, okay, let's collaborate on this. Let's see how we can work together on this. You know, you seem to be unhappy being around your friends, or you don't want to be around your friends. What can we do to brainstorm and help solve this problem? And if it's, again, if it's a parent and child thing, then, and if you have a spouse, that maybe you might want to let them in on that, to let them know what's going on, so that you can have kind of a coordinated effort.
Yeah, that collaborative approach, right?
Yeah.
So asking questions and seeing if the family member has some ideas in terms of what they can do to make themselves feel better, right?
Mm-hmm.
So it's not coming down and saying, I know what you need to do. It's trying to make it, working as a team there in that circumstance.
That's right. That's right. So, and if we're talking about, again, like a sibling or another, like a cousin or something like that, where it's not the power dynamic of the parent-child, you know, I think it's really fair game to just say, I tell you, I'm really concerned. You know, this is not the behavior that I've seen from you before, or not the way that you've acted in the past. I'm really concerned about you, and you know, I hope that you'll accept some help if some's offered, you know.
Yeah, or maybe vet some of that help, or say, I heard good things about this therapist, or so that maybe that's where you can offer a little bit of feedback. That might be an opportunity to do so.
Sure. Here's the thing. Just to go to the extreme of this, at least in the States, you can't force someone to go to therapy unless they're of grave danger to themselves or others. You know, if someone is just withdrawn, if we're talking about an adult who just seems to be acting differently and is withdrawn, but they're not harming themselves or not harming anybody else, you can't do anything more than invite them. You know, you can't force.
Yeah, same with up here.
Yeah. Mm-hmm. And sometimes people, at least down here, they don't like that. You know, if they're a family member, they're like, well, you know, she needs to take care of herself, or she needs to do. You know, people still have kind of free will, and they can do. They have independent rights and freedoms, and we can't make anyone do that. And especially when it comes to getting help. I mean, one of the common things that I heard in graduate school was that almost all sorts of therapy, almost all types of therapy, help people in general, except for court-ordered therapy. Court-ordered therapy doesn't generally, I mean, it helps some people, but it doesn't help many. And why is that? Well, because they have no real investment in being there. They're forced to go. if someone is forced to go to therapy, then they don't really, they're just doing it to check a box. They don't really want to be there. It's not to say it never works, but just generally speaking, it's one of the least effective forms of therapy, or venues for therapy. And the same thing goes, I think, if you try to force a loved one to go to therapy, that's basically just court ordered, and they're going to, watch the clock and try to write it out. And unless they find a reason for themselves to go, it's probably not going to work.
And I think in those circumstances in private practice, if it is a family member going, they're almost using it as a like a kind of a scapegoat, or something to point their fingers at and say, see, I went and it didn't work.
Yes.
I did what you wanted me to do. I went to therapy and it didn't work.
Yep.
Or even a self-fulfilling prophecy. I guess that was more the term I was looking for, right? And then it's like, see, no one can fix me. I'm broken. And that might feed into the depression or the anxiety or whatever that might be. More reason to push people away.
Yeah. So yeah, free will for sure. So if it's a sibling, then you can still, based on your free will, so reach out to the person and check in every couple of days and see how they're doing.
Because
Or
someone,
ask that question
hold
that
on, just hold on a second. Is
Yeah.
someone tossing
Yeah.
around a bag of pennies or something?
Oh, is Joanna's hair on her microphone?
Oh, sorry. Yeah, let me know if that happens. I can't hear it.
Oh, it's so funny. It sounded like a bunch of bottle caps or something. It was really, that's funny. All right, sorry. That was that noise. It's not jingle bells. It's Joanna's hair and her microphone. I got it. Okay.
I have like a
sorry.
metal
funny.
clasp on here, so maybe it was that. Anyways, yeah, let me know if that happens. I
maybe.
can't hear it.
Okay. We'll give you a
makes-
sign.
That's good. All right. Sorry, Chris. I totally cut you off.
I can't do that. Yeah. Again, you can mention the family member, I care about you and I'm gonna just check in on you every couple of days, and so you can be persistent and patient with it. A while back, we talked about if someone's pre-contemplative about getting some support, I always ask them like, well, you're not open to getting some support now, but when would you be open to getting it? Or and usually you get some really good answers saying, well, if as I'm still functioning, if it starts to impact my work, then I will. And then that may happen. They may cross that line and then might be more open to maybe having some opportunities for counseling or something.
Yeah. Another piece that I like is I like to meet clients where they're at, but I think that's also important when it comes to friends or family members who are struggling, to meet them where they're at. So while we want to invite them to join us in activities, I think it's important for us to join them in their activities. So if they're going to be hanging out reading, it is okay to ask, do you mind if I sit in the same room as you and I'll read too? We don't have to talk, but is it okay if I join you in your activity? Or you're playing video games, is it okay if I sit here and watch for a little bit or play as well, if you know how to play that game, right?
Sure. I think that's great.
Yeah. Even if they're just lounging in bed, like if there's something that you can do to be like, oh, you look really cozy, I'm going to sit on your floor for a little while. We don't have to talk. I'm just going to sit here on the floor in a blanket burrito and we can just be quiet together.
There we go.
It's I'm going to join you. I'm going to break that. It's okay. I'm going to be here. And because sometimes it's really hard for them to come and do your activity, right?
Sure. Great points. And yes, and maybe sometimes just that if we have someone again who's resistant, they don't really feel like talking, maybe just by spending time and showing that you care about them and you're willing to just be with them, not even pressuring them to talk, that may even have the effect of helping them to open up, right?
Yeah.
So, and if we're talking about the other side of things, if we're talking about more severe mental illness, someone seems to be having a psychotic break, they're kind of losing touch with reality, or they are seem to be very kind of lost in their addiction, or really do seem to be so depressed. Maybe they're showing signs or talking about feeling suicidal, something like that. When do we crank it up to the next level and get some more people involved, do you think?
Yeah, so I don't know if that's going to be different just depending where we're living, right? But if it is a crisis situation, we have various services in our community. So whether that's going to the emergency room, if need be, we also have like a early psychosis intervention or the START team, short-term assessment response team, that will come and do an assessment. You can do mental health checks with the police as well. They're working on adding a psych nurse to that. So it'll be an officer in a softer uniform. So it's not the full vest and everything, with a mental health, somebody who's trained with mental health that will go with them. I don't think that part is part of the mental health checks yet, but they're working on developing that. Yeah.
Yes, that all sounds pretty similar to us. Certainly ER or emergency rooms. Ours are called psychiatric evaluation teams, the PET team. And I've heard more talk about for the police having even a more dedicated mental health unit just to help address mental health issues, which I think is great.
Yeah.
I think, and certainly things like a suicide hotline, even backing up a little bit, just alerting like a family physician if there's someone who's, that's what's going on. Just gathering more support. If we're talking about someone who's at risk of hurting themselves or others, or there's they really seem to be severely ill, then even if there are taboos about talking about that sort of stuff in your family, this is the time to break those walls down, and let's get all the support we can for our loved one.
Yeah, we have to rally the troops, get a team around them. So
exactly.
Yeah. Another option as well, not just for reaching out resources like to other professionals, but I highly recommend that family or friends, depending on your age, do some reading, get some education around if there is a diagnosis of what's going on. If then let's start educating you, right? Let's get you some websites that are credible and good books, or if there's podcasts or whatnot, let's get you educated on what to expect with it, what behaviors might be normal for that diagnosis, what to anticipate, see if there's support groups for family members. I mean, there's lots of other things there too, right? That you can do on your own, because now again, that parallel process of, oh, so now me as a family member could reach out to help, but do I feel that I'm at a space where I need help?
Yes.
And should I reach out for counseling? But I don't think I need that right now. So are there other ways opposed to reaching out to other professionals? Well, you can always read.
Yes. Educate yourself. There's certainly a lot of support groups down here. We have a group called NAMI, the National Association for Mental Illness, which is just families and friends of people, loved ones of folks who are struggling with mental illness, as a support group. Very helpful and popular down here.
Yeah. Cool.
Chat rooms, forums. Those are all kind of variable degrees of helpfulness, but you can at least find other people who are dealing with the same thing.
Yeah, that's a very good point, Brooke. I think that's really important, because you can once you learn more about whatever's going on, and then you could, it might show up in different ways for your loved one, but it just helps it helps you understand kind of what's going on, not to take certain things, personally sometimes, or just to be able to gauge, I don't know what's going on, and to have that understanding might help you feel more confident in how you approach them or how you support them. So I think that's so important.
Stay calm about it.
Yeah.
And to kind of anticipate it a little bit. And I think that's so important.
Yeah.
But it's also, I think, builds some compassion. Hopefully there's an insight around it, in the sense of not just the education reading, but often I will send parents an email with resources. Here's a few websites, here's a few books, here's a few things like support. If there's a support group in the issue that they're worried about, here's a bunch of things. And when I follow up with them, they'll say, oh, I haven't looked at any of it yet.
I know.
So meanwhile, they were the ones who, like, there's a sense of urgency, rightfully so. Their child is not doing well and they want to know what to do to help. And so we start this journey together. But in that moment, I find that it's helpful to have that conversation of saying, yeah, so here you are, you're a parent, you have the desire to, you have the tools, you haven't been able to for various reasons, and that's okay. Now let's put yourself in your child's shoes. If we give them homework to do from counseling and they haven't been able to do it, we need to be compassionate and kind. There needs to be some understanding or flexibility here. Because as you can see, it's not that easy to just read the book.
Yeah.
Because there's that, again, that anxiety that's being then projected onto the person, the identified patient.
Yeah. Yes, I know we're going back and forth in terms of supporting like a sibling versus a child, but supporting a child, like it's such a tough situation for parents to be in because they don't want to see their kids suffering. At the same time, if your child is exhibiting symptoms of anxiety or depression, you want to do everything humanly possible to support them in terms of doing the things they need to do to get the support they need. So anxiety, for instance, I've talked to a lot of teachers and sometimes parents swoop in and say, my child's really anxious and maybe it's best they don't do this test or exam. At that age, it would be a great opportunity for them, the children, to learn how to step into that discomfort and learn some tools and techniques of that before it becomes more intensive the older they get. So being very careful not to enable certain behaviors.
Great stuff.
We could probably spend a whole nother podcast in terms of parenting techniques here. But anxiety is a big one. It's popping up constantly.
Sure.
And then I was going to say too, I don't know if you guys have anything to add to that, but.
No, go for it.
I was going to mention something too about addiction, because when it comes to addiction, the person who's experiencing the substance use is often, it could be multi-layered. There's so many factors that play into it. We've talked before about the connection of trauma in the past, but there can also be someone who's experiencing desperation, and with that can lead to manipulation. So they may be kind of contradicting their values a bit and doing everything they can to kind of maintain that addiction. So boundary setting is so important in supporting family members who are experiencing addiction.
What's
so
that like? What do you
mean?
Many forms. Yeah.
In terms of setting up boundaries. Well, for instance, money. Like if someone is asking, a family member is asking for money, or just being careful where that money is going. So you may want to ensure that it's going going in the direction of something that will actually help them out, not just giving them money that could be potentially used for drugs. So often if someone's experiencing an addiction, it impacts all the key aspects of their lives, and they may lean on family members to help them navigate through that. And family members have the best intentions to supporting those family members, but it kind of keeps them stuck in that addiction instead of maybe getting the support they need.
Addiction's so scary for families, right? The last thing they want is to see that loved one out on the street, and just anything that could go from that, right? But yeah, it's scary. But those boundaries will keep being pushed. And then at what point are you actually keeping them in the addiction? But yeah, this could be a whole other podcast for that.
Oh my gosh, there's so many. I feel like
tricky.
This topic could be broken down.
Yeah, no, it's definitely tricky. And I'm not by any means just saying play the tough love route there, because you got to navigate through it carefully. But you mentioned those boundaries, sometimes they do get pushed, and often the clients or family members experiencing the addiction they sense that, right? They know who to go to or what to say to kind of get what they want.
Yeah. I would say that if we're talking again about you're trying to help a loved one, one of the best things you can do is model healthy behavior for them, right?
Yes.
And this is going back to what we're talking about, like checking your own anxiety. If you're having a hard time even holding these conversations with them because you're so anxious, then maybe it'd be great for you to find ways to manage and contain your anxiety.
Or even just your own stress stress in general, really.
Yeah, and manage your own stress in general. You know, if you go and take steps to try to manage your own mental health in some ways, that's a good thing. And even if you come back and talk about it, well, I went to a therapist and I learned some things and it's feeling good. I realized I've been doing A, B, and C, and that's been good for me. Not to show off, not as a manipulation, but just as a genuine, explanation that, yeah, we all need to get some help sometimes. We all can benefit from asking an expert for some help. And when it comes to working with addiction, I agree with you, Chris. Boundaries are always key there, because really the addiction itself wants to break boundaries, wants to push boundaries in order to serve its own needs, right? I want the drug, I want the substance. So who cares about the lock on the door? Who cares about what time it is? Who cares about money? I want this more than anything else. Who cares about the relationship boundaries? But if you can model boundaries and say, hey, look, this is what I'm able to give. I can't give anything else other than that. And that's where I am. There's something that conveys a message that, yeah, we can set a boundary sometimes. There's something, it's possible for us to say no. And I know that addiction is much more than that, but at least it's a good reminder for people that we don't have to become subject to impulse all the time, right? So I think there's a lot to be said for that. And yes, we could spend a whole other, we will bring out an expert sometime to talk about addictions, and maybe Gabor, how do you say his name? Gabor Mate. Yeah. Well, I'm going to send him a tweet and see if he'll be on our podcast. And he could shoot us down too. I'm just kidding. He's a big deal. Yeah. It'd be great to have him on though.
You know, it's funny, is Joanne and I's dad went to school with Gabor Mate at UBC. So I think they knew each other back in the day there. Maybe ran in different circles, but knew each other. And back then he was known as Gabor Matt.
I thought it was Gabor Mate.
Gabor Mate? Yeah, Gabor Mate. That's it.
Gabor Mate.
And now he's Gabor Mate.
That's great. To wrap this up a little bit, I want to go back to Joanna's question of like, okay, what if we've been talking a lot about resistance, or maybe I introduced that whole idea of like, what if something doesn't want to go? How do you get them to seek some help? All of that is for a lot of people, that's a big struggle, but it's not always the struggle. Sometimes you have someone, a loved one, it's a spouse, it's a child, it's a partner, or a sibling, whatever it might be, who's actually in treatment. They're doing what they can to take care of themselves, and you're just wondering, what can I do to support them, right?
Yeah.
It's not a struggle. You just want to know, oh, hey, this is my spouse, and she's in treatment, and I don't know what to do about that. How would you intervene with something like that?
Well, I think it kind of full circles back to, I think there's like key points that'll come up, as you mentioned at the start too, Ryan, that there's going to be themes to this. But I think a large part of it comes to communication skills, healthy communication, and connection. So focusing on the relationship and having a strong relationship, and a big part of that is having healthy communication. Because I think when you're feeling connected and when you're feeling heard, that's a great space for healing in general. And so if that means sitting with negative emotions, if it's a hard day, if it means being attuned, if it's a partner, like if you have picked up what this person normally does when they don't feel well and automatically doing those things for them, that's going to go a long way, because they're going to feel that someone has seen them and heard them and is attuned to them, and somebody has them, somebody's got them. They can feel assurance there.
Totally. Yes, the connection and the communication, right? I think the main thing you can do is ask, hey, how can I support you during this time? Right? Anything I can do to help? Anything you need from me? Happy to be here to support you. And hopefully if they feel safe enough to ask you and, feel like, okay, I'll trust you with some of this, they can tell you, all right, here's what it would be helpful from you, right? Which I think is important. For some folks that maybe just, they want an ear, they want someone to lean on and be able to talk to. Maybe they need some help with some things. Oh, hey, I started taking some medication and I need someone to help me keep track of that, or, can you check in with me after a session because I tend to be kind of out of it, whatever it might be. It'd be great to just to offer up your help and be able to lend that support to them.
For sure.
Yeah.
Joanna gone. That's it.
Yeah, she left. That's it.
Okay.
She took her bag of nickels and went off somewhere. Well, that's all right. So I guess we'll just end on that note. Joe already ended, so the rest of us will end. So that is it, everyone. Great topic, by the way, Brooke. Great topic. Great topic. I know you were tired today, but you really came with the good topic for us.
Yeah. And next time, our banter, we will answer the question, are aliens actually humans who have learned how to time travel?
I would love to answer that one. It's kind of out there, but I love it. So that's it. Like and subscribe. Oh, there's Joe again. Like and subscribe on Apple, Google, Podbean, Audible, Spotify, Stitcher. That's our new addition, Stitcher or YouTube. Send your questions to info@mentalhealthbootcamp.com. Visit us on Facebook or Instagram. Tell a friend or two and read together because we're going to talk about it together next week. Good night, everybody.
Everybody.
Bye.
Bye.
Thanks for listening.